somebody has and feels a true, authentic sense of belonging in an organization where they feel they're heard, they're valued, and they're appreciated, we also see in study after study that they probably are not going to look at another job if that's the case. What we also see in there is that very large number of those responding said, I will look for another job because of my manager. And so we know that this is the case in every industry, but ultimately I think the call to action for every leader, regardless of role, regardless of where they sit in an organization, is can you confidently say you're contributing to your team members and your team's mental health in a positive way? Or are you the reason that they're having poor mental health? And I think if you can't answer that, there's a good chance, obviously, that you're not in touch with your team.
Hello and welcome to the Making Better podcast, where we help business leaders make their teams and organizations better. Our goal is to give you actionable insights to help you improve your own performance and the performance of those around you. Our guest today is Geoffrey Roche. Geoffrey is the North American Director of Workforce Development at Siemens Healthineers and National Healthcare Practice Executive Advisor at Core Education PBC. He often speaks on healthcare workforce topics at national conferences and has been nominated to the Forbes Business Council. I wanted to talk with Geoffrey today because, as you will see in this conversation, the healthcare industry is facing many of the same challenges as every other industry. They are just feeling them much more acutely for various reasons. And so in this episode, I want to talk all about the solutions that they are finding to those big challenges. Expect to learn important tactics for dealing with generational change in the workplace, how organizations can better support new leaders after their promotion, what to do to prevent burnout, and the difference between empathy and sympathy. But before we get into that discussion, I do want to remind you to make sure to like and subscribe so you never miss a future episode. And if you are already subscribed to this show, then if I could ask you to please share this show with just one other person, because that is how we grow. I can't tell you how much it means to me. And so with that, let's get into the discussion with Geoffrey Roche. Well, Geoffrey, I am so excited to have you on the Making Better podcast. Thank you so much. How are you doing today?
I'm doing well, Matt. How are you doing?
I'm doing great. I'm really excited to talk to you today. We first connected a few months ago, and you're a very different guest, I would say, than most of the guests we've had on, because we talk a lot to folks in the talent development field more broadly. And you, I would say, you're in the workforce development space, but specifically within healthcare. To kind of kick us off, I would love to have you run us down. I mean, I think we all have known, since COVID and the healthcare industry had so much focus, but I'd love in your words, like, what are some of the challenges facing kind of the healthcare workforce in the United States right now?
Yeah. Well, obviously, to your point, right? I mean, healthcare out of most industries is facing some of the most drastic, most challenging times ever. And, certainly it's a lot of different aspects. Certainly the supply and demand element is really important to highlight. There's just not enough healthcare professionals graduating out of community colleges, out of four-year private, public, and even when we get into, medical school, nursing school, physical therapy school, you name it, we just don't have enough of that supply to meet the demand. And then at the same time, we have the retirement element, particularly of our baby boomers and such, who are obviously have served their duty and their time and are deciding that it's time to retire. And so we just don't have enough of the supply to meet that as well. And so, we're really in a really difficult spot. And then we also have the element on the academic side where so many programs, because they're healthcare related, are, specifically told this is how many students you can have per faculty student ratio. This is how many students you can have for this accredited program. And so there's just a lot of different factors that are definitely in play here. And then you also have a gig economy where so many people have said, you know what, I don't want to work that normal shift job. I want to have an opportunity where I get to choose when I work, where I work, how often I work. And so in healthcare, that's had also a dramatic shift as compared to before, where people would come in and do their normal 5 hour, 5 day work week or 3 day work week for nurses, 3 12s, for example. Now we have people who say, you know what, okay, I want to do that, but I don't want to do it at the same place. I want to do it here, I want to do it there, and I want to do it somewhere else. And so, very, very different dynamics. And I think what also has to be talked about, right, is culture.
Hmm.
Organizational culture is super important right now. Also, the fact we've got 5 different generations in the workplace. And
Yeah.
I think in healthcare, we just haven't harnessed the potential and the excitement around what that means. To me, it's
Hmm.
exciting when you think about it. We should be finding the unique qualities that each and every one of us brings into that workplace and harness that and create the most creative, innovative, culture that one could imagine. But I think we just kind of tend to look at, well, this person doesn't do this, they're younger, they don't do this. We just tend to get into the criticism rather than actually think about it constructively and in a hopeful way. So definitely an interesting time in healthcare, and will only continue to be interesting because they're
Yeah.
expecting 2027, 2020, 30 will have even more significant cliffs of people leaving the workforce. And again, well, whether we'll have enough to or even get close to having enough to fill that is to be seen. But I'm not optimistic.
Oh yeah. Well, I mean, and this is exactly why I wanted to have you on because, to listeners who are saying like why are we talking about the healthcare industry? It's cuz I mean everything that you just listed, the gig economy, lack of talent or lack of workers, lots of people retiring, generational shifts. Those are all things that every company, every industry is facing, and I think it's just in the healthcare industry because of one, like you mentioned, the regulation, but also just kind of the natural stakes of the industry. Like you probably feel a lot of those pains a lot more acutely and really need to solve them. And so that's why it's really interesting to look in your area to say, okay, like what is happening? What is going on? I mean, we could kind of start at the end of what you just mentioned. You mentioned culture and generations, all these different generations working together. That's something that we see a lot. How are you seeing that play out, and what are you working to do? What are you seeing be effective at kind of getting through that, or as you said, trying to
Yeah,
take advantage of that instead of seeing it as a problem?
yeah. I think, I'm encouraged from the vantage point that I'm seeing more and more healthcare employers really think about the fact that, the idea of benefits do matter. And we
Mm,
have to be thinking about how we shift our benefits and what we offer to our employees around the different aspects of generation. And so, we're no
interesting.
longer at a time where we can just think that health insurance alone in healthcare is going to be a big driver of whether someone chooses to work for me or another organization, for example. And the reality of it is that for so long, healthcare was that type of place. Great healthcare, great benefits, wouldn't consider, somewhere else. But there's so much more involved, right? And so we see today, survey after survey, employees cite, if you invest in me, if you help me grow personally and professionally, whether that's degrees, whether that's master's, bachelor's, master's, doctorate, whether that's additional training, professional development, we now call that aspects of investing in one's career mobility.
Yeah.
Very, very important. In fact, younger generations have cited in employee engagement surveys and other reports that if their employer invests in them, there's a greater likelihood that they will stay there because they'll see it as a tangible example that they care about them.
Yeah.
The other aspect that I think is super important is, look, if somebody has and feels a true authentic sense of belonging in an
Hmm.
organization where they feel they're heard, they're valued, and they're appreciated, we also see in study after study that they probably are not going to look at another job if that's
Yeah.
the case. There's a lot of research though that, I always go back to. UKG did some amazing research last year where they surveyed across the globe thousands of people. And what the research cited was that 69% said that their manager, and this wasn't just in healthcare, but healthcare was a large pool, 69% cited that their manager was a poor contributor to their mental health.
Wow.
What was ironic about that survey and that report was that 69% also cited that their spouse or partner. And so if you think about that, you've
Huh.
got bad manager, hurting your mental health or causing travel trouble. And then at home, you have that. No wonder why we have this significant mental health crisis in the
Yeah.
United States in the way that it has become so large today. And so, what we also see in there is that very large number of those responding said, I will look for another job because of my manager. And so,
Yeah.
we know that this is the case in every industry. Again, I will argue that I believe healthcare is probably a bit more challenged by this because, in many cases, people that are in management tend to be there for a longer period of time in healthcare. We're starting to
Okay.
see that shift. And we haven't necessarily moved the full generational shift in leadership yet in healthcare. We're getting there. But ultimately, I think the call to action for every leader, regardless of role, regardless of where they sit in an organization, is can you confidently say you're contributing to your team members and your team's mental health in a positive way? Or
Yeah.
are you the reason that they're having poor mental health? And I think if you can't answer that, there's a good chance, obviously, that you're not in touch with your team. And so for me, I'm not shocked by this research, but I do think it should be a call to action that we really invest and we really understand what is the creating a culture of belonging like, and also making sure psychological safety is there. Because also, if we know people feel that sense, they're not going to look if they've got a good leader. We see that time and time again.
Yeah. Yeah, and I think I'm sure, we were talking a little bit before this, so my background is from, aerospace. So I was a pilot, and aerospace went through a big sea change back in like the 80s and 90s after a series of crashes that
Mm,
were totally avoidable. There was 100% human error, just people in the cockpit not paying the right attention. And a lot of it came down to the root cause of this idea that there was a culture of the aircraft commander being in charge. Like obviously they're in charge, but they were truly in charge. Everybody just like everybody else was there to kind of take orders. And it resulted in a big change of where they introduced a lot of training called crew resource management. That was all about how in the cockpit do you work together so that everybody's sharing information, everybody has the right to speak up and say if they think something's unsafe, and all that. And it's that training has been largely responsible for the massive change we've seen in airline safety, where airline safety is
mhm,
now so safe because everybody is working together and feels empowered. And I often see that, you hear about it in the healthcare industry, but I think you hear about it in a lot of highly technical industries where, in order to get to a position where you might become a leader, you have been through a lot of very rigorous training for years and years and years, if not decades. And so by the time you get to that leader position, there's this bit of like, well, hey, I'm supposed to be the one in charge, and it can kind of create a culture where people don't feel safe speaking up. It sounded like you were speaking a little bit to that in terms of that like generational
mhm.
changeover, and changing of mindset of what it means to be a leader. Did I hear that right?
100%. And I also think, to your point, what's important in healthcare is then on the opposite, we've promoted people and then we haven't supported them early in their career,
Interesting.
early in their role as
Interesting.
a leader. That's been very real in the nursing space. We promote leaders
Mm,
and then, we just don't have the right mechanisms to continue to support them. And ultimately, we see challenges or we see them not able to continue. Well, ultimately, organizationally, we have a commitment. If we promote someone, we have to own it. We've got to
yeah.
support them.
Yeah.
It's interesting to your point. I got into leadership significantly younger and earlier in my career in my health system. And when I look back, the only reason I was able to be successful is because I had mentorship from our CEO
Yep.
and another senior vice president. And I will never forget, the amount of mentorship and the time that my CEO, who was running a very busy healthcare system, but she saw something in me. And I remember conversations that we would have where she said, I want to help you be the best that you can be.
Yeah.
And I think healthcare is a space where it's so much about humanity, but when it comes to culture, we sort of have forgotten the art of
Hmm.
humanity.
Interesting.
And, there's a really powerful video that Stanford just put out that I encourage everyone to watch that either works in or works around healthcare, called I Am Human. And this video is so powerful because it touches on all the aspects of what we as humans face and what we as humans in healthcare experience.
Hmm.
And I just think we have to get back to some of the most important aspects of humanity in healthcare. And when we do it, we can create not only the best cultures, but also the best examples of leadership.
Yeah.
Because in essence, we're there to serve. Whether we're serving patients or we're serving colleagues, it is all service.
Yeah.
And it's interesting to me that people have gotten into healthcare that doesn't seem like they have any sense or want to even be a servant. They just
Interesting.
want to be a command and control person, or they just want to bark orders at people. That's not healthcare. Never
Yeah.
has been. And to the earlier dialogue we were having, it's the same thing about the older guard of physicians. Yes, are they an integral role in medicine? Absolutely. But so are nurses. So are nurse practitioners. So are physician assistants. So are environmental service aides. So are food service aides. In healthcare, nothing works without everybody working together.
Yes.
And
Yes.
so, and I think there's other industries that are like that. I will say, though, to your point about aviation, the one piece that has always frustrated me about healthcare that I think aviation has shown right is we don't, time out our
Yeah.
professionals.
Yeah.
We don't do that kind of stuff. And, somebody who flies often, I never realized until about several months ago that even flight attendants time out. And I thought to myself, well, that's interesting. They're doing a lot of hard work too, but like, think about it. Nurses don't time out.
Really, I didn't know that.
No, nurses don't, surgeons don't even time out.
Wow.
There is nothing in regulation that says after a certain period of time, you're not doing surgery. There are,
Wow.
however, things in regulation that say a surgeon has to live within 30 miles to be able to respond to on
Okay.
call. But
Yeah.
no, there is nothing specifically that says you've got to time out. And
Wow.
so, now organizationally, a health system could simply say, yeah, we're going to
Sure.
do that ourselves.
Yeah.
But from a regulatory standpoint, no, that does not exist. And I've always said should exist.
Yeah.
Or as a healthcare system, you've got to do it yourself and try to create debriefing, try and create space for wellness, try
Yeah.
and create space for mind, body, spirit, because ultimately the impact we know is going to be there.
Yeah, that's and for anybody, I mean, I'm sure most people listening have kind of gathered what we're talking about here, but so in aviation, there's rules, and it's been long enough where I don't remember now, but typically they're referred to in aviation as like 30, 60, 90 rules, where like at 30 days you can only have so many hours, at 60 days you can only have so many flight hours, and I've actually hit that point before when I was deployed once, and we were flying like crazy. We were doing 13-hour missions because it was winter, so we could really load up the aircraft with fuel, and my whole crew, we just had to sit around for like 3 days waiting for some of our flights to fall off. And so, and you
Mm,
can imagine that in a lot of spaces, um, because they do that because of the critical nature of it. And so, like you're saying, you can imagine a surgeon, like if they've been in surgery for so many hours in a given week or a given month, like you might get kind of worried that they're starting to get fatigued. And you could certainly imagine a world where even in something like customer service, somebody's
yeah,
sitting on customer service lines for hours and hours every single day, that you might want to build in some regulated breaks there. I could definitely say, wow, that's incredible. Um, going back to a point you made earlier about how something that often doesn't happen is promoting people and then not giving them the support they need. I think that's common in so many industries.
mhm,
Are you seeing examples of what kind of support is working well? Like, where are you seeing trials? That's kind of what you do, is like really push these experiments
yeah,
and try new things. What are you seeing that really has the most value when a
mm,
leader is first promoted?
yeah. I've been really encouraged. There's definitely been some really innovative thinking. Thomas Jefferson, for example, in Philadelphia, they realized, particularly in the nursing space, that, as individuals were retiring, you know, in many cases, many people retired because of how impactful COVID was. But in
Right.
some
Yeah.
cases, they weren't
Yeah.
actually ready necessarily to retire. They just realized, you know what, I don't want to be, you know, working this many hours this hard anymore.
Yeah.
But what they did is they created some really cool mentorship programs where they brought back the retirees who were
Neat.
then, brought in to work with a younger nurse to help them in the idea of matriculating from, being an academic nurse into becoming, a nurse, or
Yeah.
mentorship from, a more experienced leader to a younger leader. That's the type of stuff that certainly is incredibly impactful with certainly some phenomenal results. So certainly mentorship. I think, obviously nursing has really been a space that has done some really incredible work, particularly in these issues around professional practice and councils. I've certainly seen more and more work around supporting the younger physicians. Novant Health, Dr. Jonathan Fisher, who I always point people to, is an incredible voice on wellness in the physician space. Actually has a book coming out on the connection of your mind and this type of stuff to your heart. He's
Hmm.
a cardiologist, and so
Oh, neat.
he's done an incredible amount of work on that. And I know that he is educating and training the new physicians that come into the organization around all these types of things too. So there's definitely some really, really good work here occurring. I think it's a matter of how do you scale it, how do you make sure that you're measuring the impact, and then ultimately, the other piece I always say is you've got to reach everyone as much as possible because we can't just focus on our current management, members. We've got to focus on the entire workforce because that's our
Yeah.
future management. And
Yeah.
so whatever we do, we've got to always be doing that. And I think like most other industries, we've historically in healthcare invested more at the management and higher levels as
Yeah.
compared to investing, as the full community.
Yeah.
And I think we've got to stop that. The reality of it
Hmm.
is that we've got to look at the short term, but then also the long term game here, and you've got to be doing both. I know resources are finite, but the reality of it is I was just reading a couple months ago that expectations were that employers across all industries were going to actually decrease the amount of investment in learning and development
Yeah.
in budgets.
Yeah.
That in my opinion is probably one of the worst decisions you could make right now.
Yeah.
When if you know retention is of utmost importance to you as an organization, then investing in your team is going to be not only a dramatic impact to that, but
Yeah.
also from a retention standpoint, but also continuous learning we know helps people continue to do their work better each
Yep.
and every day. And
Yep.
so I think we have to start as a society to really, in an organizational capacity, regardless of size of an organization, to really realize that learning and development is not only transformational for an organization, but also for the person. And there's
Yep.
absolute bottom line impact from a financial perspective. And so I always challenge our CFOs of the world, like, don't be so difficult on this because study after study has shown when we do it, the ROI is absolutely there.
Yeah. Yeah. And I think another way that I like to think about it for leaders at all levels, whether it's at the whole company level or at the, you're a frontline manager with a small team, if you aren't investing in your people in that way, if you're not creating opportunities for learning and development, really what you're doing is you're putting the future success of your team in other people's hands, because the
Yeah.
only way that you're going to get better, that you're saying you're expecting people to get better somewhere else, they're going to go to school somewhere else, they're going to learn somewhere else, they're going to do things somewhere else to get ready so that then they can come to you and improve your team. But
Yeah.
you have no control over that. You don't know what's going to go on there. And so investing in these kind of opportunities is the only way you can kind of take charge of your own destiny.
Yeah.
Yeah, I really loved what you were saying early on in terms of what works for leaders and focusing on that mentorship idea, because especially in a lot of technology spaces, in aerospace in particular,
Mhm.
we're kind of hitting this edge of the Cold War, and especially like the Apollo program like started all this investment in STEM and aerospace, and it kind of started this wave of people in the 70s and 80s and 90s that entered into the workforce, and now we're losing that we're on the tail end of that wave, and there's this um, coming cliff of like all of these super experienced engineers that are going to be
Hmm.
leaving all these companies. And that's really interesting what they did there of of finding different ways to utilize them, of not just saying, okay, now you're going to retire, but you're just going to shift, we're going to shift you into this different role. Was that something, and maybe it's been done differently, but in what you've seen, those kind of transitioning the experienced people, instead of having them retire, putting them into mentorship programs, was that like typically a formal, like a new position that they got put in, where now like just, and it's like maybe it's a full-time role or a part-time role? What were kind of the mechanics of that?
Yeah, I mean, I think some are certainly doing it in, potentially new positions. Some are doing
Hmm.
it in just bringing them back in like a volunteer capacity,
Mm, hmm, hmm, hmm.
or part-time capacity,
Yep, yep,
to just help. I mean, in some ways, it's not too dissimilar from like, how other industries have leveraged apprenticeship programs where,
yeah,
healthcare has been a bit slower in this space because of all the regulatory aspects. But, certainly apprenticeships are also becoming a bigger thing in healthcare too. And
yeah,
we all know, I mean, there's so much benefit to apprenticeships too, because you're getting that on the job, but you also generally have coaches and other people who are helping you learn the trade or learn the art. And
yeah.
I think that that's critical. But, to your other point, that's interesting is, it's interesting to me, as long as I've been in healthcare, 16 years, healthcare roles have never been considered STEM.
Interesting.
Like if you look at it in terms of where STEM dollars are allocated from federal government, etc., normally healthcare roles, nursing, even imaging, other roles like that have normally not been considered, as part of
Hmm.
the STEM allocation.
Yeah,
And but at the end of the day, they're entirely a STEM field. I mean,
yeah,
everything you do in healthcare has a connection to every aspect of STEM.
yeah,
And so, I think it's definitely, and there's some great work occurring in this space. Nursing has a new initiative about nursing as a STEM. It's a new national organization. Very encouraged to see those types of things. But I think again, we as a society have to also really be careful about this because healthcare has normally been a space where many people, when you ask them what they think of healthcare at a younger age, it's either doctor or nurse.
sure.
That's usually what they think it is. But when you look at all the roles that exist in healthcare, whether it's clinical or non clinical, there's so much. But we have to do a better job of educating. We have to do a better job of helping people see the opportunities and the potential that they can be in, and then show them the way to help them get there. And then really make sure that we can help them actually get there because sometimes the system can be difficult, just
Yeah,
like other industries. And so we have a lot of work to be more intentional around that.
yeah. Interesting. Yeah, that makes a lot of sense. Um, Shifting gears a little bit, one thing that I find really interesting is, earlier on you mentioned burnout, and obviously that makes sense. Of the healthcare industry, in particular, is an industry where it's very hard, it's high pressure, but it's also kind of, it's very purpose driven, right? Like people are there as a calling, and that can sometimes lead to even more burnout because it is seen as a calling. And I think especially today, where so much of the ideas around work are about finding purpose, and I think people are thinking a lot more about that, where they're trying to land in places where they really feel like they're doing something. Obviously, when I worked at SpaceX, like that was a very purpose driven organization.
Mhm.
What do you see as happening? What do individuals need to do in specific, and more, maybe more importantly, what do leaders need to do in those kinds of environments to foster that purpose without it kind of going too far and tripping into just causing lots of burnout?
Yeah. Well, the first thing leaders have to do is to show and model the way.
Hmm.
I mean, in that same UKG survey that I was sharing earlier, there was actually a part of it around that. If a manager or a leader also admits that they're facing their own challenges, whether it's in mental health, whether it's wellness, burnout, that has a huge implication and impact on the rest of the team because they see their manager or their leader as a human.
Yeah.
And I think oftentimes many leaders they're afraid to be vulnerable
Yeah.
with their teams because they're afraid that it's going to actually make the team feel like, oh, they're going to have sympathy on me or they're going to be easier on me. But the reality of it is we're all human.
Yeah.
And good leaders know that it's okay for the team to see emotion. It's okay for them to also admit that it's okay not to be okay.
Yeah.
In fact, that's the best situation for a leader to do, because then everyone can rally around just in the same way that we want to be able to create that with the rest of our team members. And so I think that piece is super, super critical. They've got to model the way, and then they also have to support the team. I'm always, it's just like this big argument as a society we're going through right now around returning to the workplace or working from home.
Yeah.
And I think there's a lot of opinions on it, but here's where I see it. At the end of the day, there are some roles that you have to be in person for.
Just going to
Healthcare
be that way.
clinically is one of them.
Yes. Yes.
But outside of that, if if somebody can do their job wherever they're located, and let's have empathy. We don't know. They may be taking care of a parent, they may be
Yep.
taking care of a special needs child, they may have other aspects. Generally the employer doesn't always know those facets. Or maybe mentally they do better working from home than they do in the office.
Hmm.
Generally, an employee is also not going to come out and just say that for
Yeah.
various reasons.
Yeah.
And so I think, this is where employers have to be empathetic and leaders have to be empathetic. And there's so much research and so much data that suggests that if we create a more empathetic culture, and again, I'm not suggesting a sympathetic culture. I'm
Oh.
not, because I know there's going to be some people here that are going to say, "Oh, here he goes. He wants to make it as if the employee is in the driver's seat." I'm not suggesting that fully. Now, I do think the employee should be in somewhat of the driver's seat because I do think we have been a bit too hard nosed in many
Hmm.
cases at the leadership
Hmm.
level
Hmm.
in far too many organizations. But I do feel that we can be more empathetic, and I do feel that when a leader is empathetic, what we find is that people genuinely will actually work harder,
Yeah.
but they can also work smarter.
Yeah.
And you create that culture, where I've worked for leaders that will say to me, "Go to your children's sports things. Make sure if you got to leave at 3 o'clock and it starts up, get there because it's going to make a huge difference. And we know that sometimes you're going to miss it because you've got to travel, but make sure you're there." That's the right leadership. It's not the right leadership to be difficult on those things because ultimately we spend more time at work many times than we do at home. And
Yes.
so we've got to have, a complete understanding of that. And, Dr. Murthy, our Surgeon General, calls it work life harmony. And I agree with Dr. Murthy. You've got to have work life harmony. In fact, I tell every employer when I speak on these subjects, check out the Surgeon General's mental health framework. It's super, super insightful, actually. The amount of stuff that he has put in that framework, every employer should be utilizing it and putting it forward as a framework within their organization. It's profound. It talks about work life harmony. It talks about, the sense of belonging. It talks about everything from, culture to, all those things. And it's backed by science, which is
Awesome.
powerful. Great framework.
I love it. We'll definitely include that in the show notes. As you were talking, something that it sparked a memory of mine because I'm listening to an interview with Reed Hastings right now,
Mm,
the co-founder of Netflix, and he was talking about a realization that he had early on, where he would, if somebody asked him, he would always say, "Well, family is most important. Yeah, that's what's most important." But then he was never at home. Like if an employee came to him, it's 5:45 in the evening, he's getting ready to go home, employee comes in with an emergency, what do you do? 100% of the time it's, I'm solving that emergency, or maybe not
mm,
emergency, I'm solving that problem. And so the hack that he used is to, that I think fits in with kind of figuring out this work life harmony, is he made a budget for himself, where,
mm.
which he's not saying what the level should be, but that you have a budget where he said, I am only allowed to stay late at work 11 days a week, or sorry,
Wow.
not a week, a month, 11 days a month. And so that way he had to kind of pick and choose when an employee comes in at the end of the day. Is it true that he is the only one who can help solve this? Is it true
Yeah.
that it is this critical emergency that must be solved now? Or could they figure it out themselves? Or will it be okay if they handle it tomorrow? right? And, so he stays late one day, then he has to cancel another day. But the point that he's making is not that 11 days is the right number, but that you need to create some kind of framework to be thoughtful about this and to prompt yourself. Because it's similar. I remember years ago, I don't remember where I heard this. But it was some kind of discussion about end of life care and when to decide enough is enough, or something. And the doctor in the ER was saying, look, like in the ER or in the hospital, it's usually just easier. It's simpler for us to just do all hands on deck, to just throw absolutely everything at it, to just keep things to keep things moving forward. And so that's why it often does that, unless there is lots of pre-set up agreements or legal measures or things like that, where you clearly state your intentions. I think that can kind of be true in the workplace as well, especially earlier in your career, especially in a high pressure situation, or where you have a lot of potential for advancement. Sometimes it's just easier to just go all in on work all the time and never really question it. And so having those frameworks are really important. So I'm really excited that you mentioned the Surgeon General's mental health framework, because I'll definitely link to that and take a look at it. So thank you for that.
Absolutely.
I want to be respectful of your time. So as we close out here today, I do want to finish. I would be really interested to hear your answer to this, given your kind of background exposure. But the final question we've started ending with is, if you could change one thing to make the world better, what would it be?
Yeah, it's profound, right? I think probably the thing that I would do is, within the healthcare space, I would first really embed empathy into all facets of what healthcare education and training is. And then at the same time, on the organizational side, I would embed it into all aspects of hiring, performance, and certainly even, the way we assess individuals and such. Because I do feel that at the end of the day, if we can what really will lift the needle here in a really challenging situation is really around culture. I mean, despite supply and demand, I do feel that we just have had some significant organizational culture elements, just like other industries, and we just have not been the most prudent to solve it. And I think you can solve it with more humanity. And so that's what I certainly would do.
I love it. Solve it with more humanity. I think that's it. I think that is such a tagline for our age, at a time where everybody's talking about AI and more technology, and we're losing the jobs and everything's falling apart. And oh my gosh, what are we going to do? Truly, it's about turning inward. I mean, like, okay, so like, what are the things that humans uniquely bring to the table? That's some of the things that are most missing, which that's awesome. So Geoffrey, thank you so much for the conversation today. I think people are going to get a lot of it. There were a lot of great nuggets in there. Really appreciate it. I hope you have a great day.
Yep, you too. Thank you.
Thank you so much for listening today. If you are a fan of this podcast and have ideas for future episodes, I would really love to hear from you. Send an email to podcast@bettereverydaystudios.com, and we would love to incorporate your ideas into the show. While you're at it, make sure to like this episode and subscribe so you never miss a future episode. I hope you have a great rest of the week, and we will see you next time on the Making Better podcast.